Overlaying the insights drawn from polyvagal theory, I think, is so beneficial for any yoga teacher or yoga therapist. Hi, my name is Sharon Longridge. I've been teaching yoga for about 20 years, and I'm constantly trying to update my toolkit. And I was really delighted to attend the Yoga Therapy Institute's recent program with Dr. Shirley Telles, which unpacked polyvagal theory in the context of trauma-sensitive yoga. Now, first and foremost, it's worth mentioning that Dr. Telles is a medical doctor who is a highly regarded neurophysiologist. She is also one of the most published researchers in the area of yoga therapy. So I knew that we were in very safe hands. In part one of the program, she took us through what's known as the polyvagal ladder, and she explained the three primary states of the nervous system, including the ventral vagal tone, mobilization, and going dorsal. In part two of the program, what she did was then overlaid, well, how can we apply evidence-based, non-invasive approaches to support our clients to regulate their own nervous system? And there she brought to the fore a list of very relevant yoga interventions that teachers can use to support their clients. So I feel absolutely better equipped as a yoga teacher having attended this program. So I know that, when my clients walk into the room, I can support them more skillfully to regulate their own nervous system and ensure that the yoga that I am teaching is in no way problematic. So I highly recommend this program. It's absolutely a couple of hours that you'll be glad you spent in this professional development.